Once we see our surgeon and he will look at the hernia, its type, then he will be able to discuss its complications and possible issues that may arise in foreseeable future with the presence of that hernia. Most commonly, the hernia presents as a lump, which may be unsightly, but as the defect in the muscle is small and the content coming through can be large and can get strangled in that area, giving us pain or discomfort, thus stopping us from our activity. So this is one of the commonest presentations where a hernia gives us discomfort when we do our physical exercise or activity, and sometimes even at rest. The other issues with the hernias are that they are not going to get better on their own, but they may get bigger with time. And the bigger the hernia gets, more complex is the surgery or the treatment to deal with that. However, one of the issues with the big hernias is that sometimes when the bowel or the omentum it gets pushed out into the hernia, because of the narrow neck of the hernia, this may not go back itself. We call such hernias as incarcerated hernias. However, as we are aware that sometimes the blood supply to the organ or the bowel can get cut off, and in that case we call this as a strangulated hernia. In case of strangulation, it needs to be dealt as an emergency and cannot be delayed, and ideally the operation should be carried on within a few hours of strangulation. Otherwise the bowel can go dead and the operation required will be much more extensive if left for longer than a few hours in case of strangulation of the hernia. Generally, if the hernia occurs in young patients, they may be athletes, or some of them could be in high training jobs, and the job may require lifting heavy weight or doing high intensity training, in which case, of course, the hernia stops them from their activity and they need to get their hernia repaired to proceed with their normal daily life and job plan. As far as hernia treatment is concerned, there are no effective treatments except surgery for hernia. A long time back, truss was recommended because those days surgery was not considered as safe for all the patients because of the general anesthetic and its effect. Nowadays it is safe for any age group if they are fit for surgery, and this is appropriately assessed. The anesthetic agents are very safe as well, and the expertise is excellent. So we do not recommend truss because the truss does not effectively control the hernia, is bothersome, restrictive, and may precipitate a strangulation as well. If the hernia pops out under the truss, it can get stuck. So we generally do not recommend truss unless there is one or another type of a very specific hernia. Generally, one is recommended not to lift anything heavy and to continue with the light activity, and if the hernia pops out, then to lie down, relax the muscles and push the hernia back so that it doesn't get stuck.